Hi there, Dr. Frank Johnson from Sports Medicine Ultrasound, here to demonstrate an intra-articular hip injection, first using a linear probe, and then I'll use a curved probe on the contralateral hip so you can compare the two in the same patient. So as you can see, I've got sterile drapes over his clothing just to make sure I'm not contaminating my sterile field. I got my sterile gloves on. I've got a sterile drape for my tray. I've got sterile gel. I've got I've got a Cavi wipe here in case I need to touch the screen. And I've got Tegaderm on top of the probes, just for that extra layer of sterile technique. We'll start here. Slide proximally until you see a ball just on the side there. And I'm going to angle about that 45 degrees. And there is a lovely view of the greater trochanter on the left, the neck of the femur, and the head of the femur.
So here's the greater trochanter of the femur laterally. Medially is the femoral head. And between the two is the neck. So we're going to talk about the head-neck junction and where you land your needle. But let's look at the head, and we're going to find the cartilage of the femoral head just here. Laying on the cartilage is fluid, and that comes down a long ways along the neck of the femur. And here's the ligaments that hold everything together. There's muscle. Your needle's going to come down and land on the lateral aspect of the head or the head-neck junction.
Now, when you're just getting started, I encourage you to have some anesthetic. What it does is it allows you to anesthetize the skin, but it also allows you to practice your needle angle and also finding the needle with your ultrasound probe. Okay. Now with PRP, we don't want to be putting anesthetic into the joint where the PRP is going. So I'm going to stop short of the joint. I'm going to grab my PRP syringe. I like to have the mouth of the needle facing down. So there's the head neck junction, or the end of the head. Now, of course, we could be a touch more lateral, but I'm happy with that. I make some gentle presses on the plunger to see how the fluid is flowing. And yeah, I'm happy it's flowing underneath the ligaments because I cannot see the ligaments thickening up. We're getting nice and gentle into the hip joint. Now, in the past, we have done intraligamentous PRP. Okay, so now on to the curve probe for the contralateral hip. So for injecting the contralateral hip, we use the curve probe. Something I forgot to mention on the first one, when you're positioning your patient, you want to be able to see their ASIS, their anterior superior iliac spine. Because when you can see the anterior superior iliac spine, you know you've got enough clearance on your hip joint to not miss the hip joint. Because sometimes you can actually get lost down in the femur, down in the groin, and not be able to find the ball and socket. So for my brain, it makes sense to me to inject from the right-hand side up the screen rather than orient the probe like this, which seems counterintuitive to me. So we'll go back to here.
So here we see the greater trochanter, then the femoral head. Now, between them, of course, we know we have the neck. And the advantage of the curve probe is you can see so much more. So we see acetabulum, the labrum, and the cartilage of the femoral head there as well. Between them is the fluid, and that fluid lies under the ligaments. On top of the screen is a large assortment of muscles. And of course, where's the needle going to come? It's going to come from lateral to medial, landing on the femoral head or the head-neck junction. Now, if we bring in the linear probe for comparison, now mind you, this patient is about 150 pounds, so both the linear and the curve are going to perform amazing. I like to do the linear probe in smaller patients, and the curve probe is mandatory in heavier patients.
Again, when I'm injecting a hip, I like to have the mouth of the needle down. Trying to do my best job to keep that needle in view as I approach the ball of the femur. It's a touch medially. I just want to be convinced that the fluid is flowing deep to the ligaments, not getting caught up in the ligaments. This positioning I'm happy with. You can see some action around the very bottom or near that neck of the femur on the right hand side of the screen.